Hi, and welcome back. We went through a very thorough exam yesterday, and if we took x-rays on you, we're going to go over them today. I'm also going to detail your treatment plan. So here's the deal. There's two types of chiropractic care. One type of care is what we call pain relief, or what sometimes I like to call patch care. And in patch care, the goal is to get you out of pain as soon as possible. And we would use chiropractic care, maybe ultrasound, electric stim, massage, different modalities that we have, maybe even decompression traction, to help get you out of pain as soon as possible. Usually that takes about a month till most people are out of pain. There's another type of chiropractic care which you do after the pain is gone, and that's called corrective care. And corrective care entails more of chiropractic care along with exercises and spinal remolding traction to get the spine to as near to normal as possible. And it's very similar to kids that have braces on their teeth, or adults that have braces on their teeth. You can't take a hammer and hit a tooth back in one visit, of course. You know that it takes time to correct a tooth or even correct the spine. So what do they do with braces? They tighten the braces up visit by visit until the pressure over time causes the tooth to move to its normal position as possible. It's the same way with the spine. You can't take a spine and move it back in one day. Of course, that's not possible because you have soft tissues and muscles and ligaments and tendons that would prevent that. So we use chiropractic care along with exercises and traction to mold the spine to as near to normal as possible. On average, that takes about 90 days. Some people with severe scoliosis, it might take up to 6 months to correct something like that. But what we do here is every month we will do a checkup and we'll see how you're doing every month. If you're not improving, then we're going to either change your treatment plan or make a referral to another specialist. If you are improving, we're going to increase your exercise or add additional exercise and traction each month that are more advanced to help you get your spine and posture to as near to normal as possible alignment. And you can see here on this chart, most people come in here and they're in pain. And after a few weeks, maybe up to a month, people are out of pain. Now what do people do when they're out of pain? They fight like heck to get down in this line again and get back into pain. But what we like to do after we get out of the pain phase is move into the correction and strengthening phase. And when you're done with this phase, after a month or 2 or 3 of care, we like to recommend something that's called maintenance or wellness care. And in wellness care, people come in our office and they have no pain at all. They're just coming in to get checked up to make sure that their body's working the best it can. We'll talk more about that later, but just for now, you need to know that when you're in the pain phase, the bones are irritating the nerves, causing a lot of pain. After a month or so, you're feeling better, but the bone is just barely off the nerve. So if you stop here and do nothing, of course it's going to worsen and the pain's going to come back down in the future. After we correct the phase, it's like wearing a braces, like we mentioned, for a while, and then a retainer brace for a while. Then we go ahead and take a re-x-ray in about 90 days. And after the re-x-ray, we'll compare your new x-ray to the old x-ray, and we'll see, are you done, halfway done, or somewhere in between? We don't know until we take the pictures. But what makes the difference is you keeping your regularly scheduled visits, and if you miss a visit, the next week come in 1 extra to make up your missed visit, because we don't want you to spin your own wheels and lose ground. Now at the end of the 90 days, we'll take an x-ray and we'll see where you're at. And this is a picture here, if you can see this, of a patient that had come in. This is their neck. They're looking this way. The neck should actually curve like half of a circle. You can see this patient's neck was very straight. They had headaches, depression, fatigue, all gone within 90 days. So this is the before picture. We started on chiropractic care of exercise, adjustments, traction, and home care. And the re-x-ray shows the spine that's normal, natural, healthy position. So if you're looking to get this fixed, you're going to have to be here. You don't want to start today if you're not going to be here in 90 days. You also have to come to what we call our exercise class. Where in that class, it's 20 minutes long, it's free, you only have to come one time. I will teach you the home care that you need to get your spine to as near to normal as possible. 50% of the correction comes from me working on you in the office and you making your visits. The other 50% is going to come from you doing your home care. So if you don't have the time or your schedule's not right to do 90 days, please let us know. Or if you don't think you're one to do the exercise at home and things won't correct, please let us know about that also, and we'll just do what we call patch care. But in a minute, I'm going to come in and show you your exam findings and your x-rays if we took x-rays, and you're going to make the choice. So think about it. Do you want to just attempt to make a temporary patch, like a loose fitted Band-Aid, or do you want to attempt to get the spine to as near to normal as possible and do what we call fix or corrective care? I'll be right in. Look forward to seeing you.